Thank you, Nelson, and good afternoon, everyone. This is Tony Singh. For those of you who are joining us online today for this Virginia PFAS Workgroup meeting. I'll start with some housekeeping items. I hope, can you see my screen?
No.
It looks
blank.
We're seeing a blank screen.
Okay.
Yeah, it's blank.
At my end, it is showing as shared. Let me stop it and then probably redo it.
Something just changed.
That's good.
How's it now? Yes.
Yes.
So,
Awesome. Thank you. We're still learning the technology even after 18 months of the telework things. So starting with the housekeeping item, we are conducting this meeting via WebEx as well as in person here. So if you are joining us over the WebEx, please use the chat feature generously for any comments or side discussions. I have my colleagues here at Office of Drinking Water who are monitoring the chat window. Usually we ask you to contact Chris Latino if there are any technical difficulties. Today she is on leave, so my colleague Nelson Daniel will be the person that you want to contact if you run into any such technical difficulties. 90%?
We've got 4 people upstairs waiting to come downstairs. Can you close?
Oh, sure.
Where are they?
Up at the front desk?
Upstairs or?
Yeah.
Okay, I'll get them.
Thanks, Dwight. Or hopefully they're on the elevator right now.
Actually, there are a few workgroup members who are at the front desk. We are waiting for them now.
Hi, sorry to interrupt. Is everyone here?
I think they're upstairs.
There's a few other people.
Yeah. So Dwight went up, but can you check and see if there's anybody else upstairs? Thank you, Nivy.
No problem.
So I think these housekeeping items, they are anyway for our online members, so we can continue that. I was saying that if you run into any technical difficulties with the platform, 80% of the time turning it back on or logging out and log back in works, so try that. And please keep your microphones on mute if you're not speaking. There will be a public comment period at the end of the meeting. So if you're a member from the public and want to comment on any of the topics discussed today or in this whole process, you're welcome to do so. Nelson, do you want to add anything in the housekeeping items?
Did you, if folks haven't already, please enter your name and the organization that you're representing in the chat feature. It helps us keep track of who's participating in the meeting. Thanks for everyone that has done that.
Thank you, Nelson. So let's wait for our members who are at the front office. Let's give them a minute here so that we can call this meeting to order. Hey, welcome everyone. Hey, please.
Thanks for letting us in.
I appreciate your
I
tenacity.
called you, but you must have been screening.
So,
I got a call, I got a message.
I'm
an
just
email.
teasing you.
I'm working on it.
I mean, maybe you guys are busy. You probably were like, who's this 912 number
the
calling?
meeting is on hold for you guys. So that, just to make sure that we have you here. Okay, so it's 1:11 and we have members.
Yeah, I was like, Kansas City?
I know, so then I texted you because I thought
I mean,
I would screen that phone call too.
I'm getting a call from Philadelphia, so I know we don't have any members in Philadelphia. So I call this meeting to order at 1:11 on September 10th. And again, I welcome everyone to this meeting. And I have this next item as introduction. So I think like we all know each other pretty well now, but for the sake of meeting minutes, if Nelson, you can take attendance who is present in today's meeting, that will be great.
So we've got 32 participants in the meeting. So I see work group members from the department from the Office of Drinking Water. We've got myself, Bob Edelman, Tony Singh, Dwight Flemmy is here from the Office of Environmental Health Services, who's part of the work group. Scott Vogel is here representing the Office of Environmental Health Services on behalf of Anthony Creech. Jeff Steers is here from DEQ. We've got Jessica Edwards-Brandt and here in the room, along with
Phil Martin, the Augusta County Service Authority.
okay, welcome Phil.
Amanda Waters with Aqualung.
Oh, it's nice to see you in person.
Yeah, me too.
And Jamie Bain Hedges is here with us in the room. Online, we have Paul Neffler with ChemLaw, who's in a couple of the subgroups. Russ Navratil representing the Virginia section of the American Water Works Association. Chris Pomeroy with Aqualaw. Henry Brenza, who is a scientist who had been with DuPont, expert in the field. Jillian Terhune, Anna Kilius with the James River Association. Jillian is with Norfolk Waterworks. Aaron Riley, Mike Hodling, who's with Chesapeake. No, Mike is Newport News. Mike McAvoy with the Western Virginia Regional Water Authority. Philip Muscas with the Potomac River Keeper. Andrea Wurtzel with Mission H2O. Chris Harbin with Norfolk. Noel Bissell, who is the Health Director in the New River Valley Health District, New River Health District. Steve Risotto with the American Chemistry Council. Wendy Eikenberry with the Augusta County Service Authority. Dr. William Mann, who is a citizen, serving on the committee. Other parties that are present are Ellen Egan with Aqualaw and Carol Courtenay with the Southern Environmental Law Center. And I think that covers everything. Dan Horn is with the Department of Health. He's also online.
Thank you, Nelson.
John Albach with Aqua Virginia is here. And there are a couple of other members of the public that I don't recognize or don't know.
Sure. Thank you so much, Nelson.
You're welcome.
So essentially, to start with, today's work group meeting, our agenda for today is pretty straightforward. As you must have reviewed the agenda, we don't have any external speakers today because we wanted to give ourselves enough time for discussions around some key topics and key recommendations from this work group that we want to include in our reports or in our findings. So we also shared a summary of PFAS sampling study with all of you. If you haven't seen that, I have shared that with you on September 7th email. In one of those documents, we have those summary results. We'll be discussing what did we do in terms of that sampling study, what did we observe, and if you have any thoughts, and how and when we can release those to the public. And then we will get into the subgroup reports. Today, because we wanted to spend more time on our section on House Bill 586 report that is due on December 1st, but our internal deadline is October 15th. So we wanted to devote more time to that one. So we have given 5 minutes to each of our subgroups for their updates, followed by a break, a quick break. Thanks to Nelson Daniel for all the snacks here. And after the break, we will get into our House Bill 586 reports and recommendations, concerns, limitations, whatever we want to discuss among ourselves. This is agenda for today. Do any work group members want to add or remove any agenda items for today?
I don't want to remove items. I just have a question. Are you already recording, or are you required to record?
We are required to record, and we are recording.
Okay, thank you. I didn't see it shown on the WebEx, so that's why I asked. Thank you very much.
Okay. Thank you. If there are no other agenda items for today, then we'll go with the present agenda. Before we get into today's items, we want to review and approve our meeting minutes from July 27th meeting. We have shared those draft meeting minutes with you. Are there any work group members who have added to that July 27th work group meeting minutes? Hearing none, we will post those meeting minutes from July 27th on Town Hall as final. Thank you. Getting to our today's agenda items, where we would like our work group member feedback. The first item is PFAS literature review document that I shared with all the work group members on September 7th. That is a draft literature review at this point, and we are seeking work group members' review, feedback, and at the same time we are requesting if any work group member have any additional information that they would like us or this work group to consider. The deadline for that is September 17th. This deadline is we have come up with this deadline taking into consideration the deadline for submission of our House Bill 586 report, because some of the literature review information will go into that HB 586 report. And we have also taken some of this information for our House Bill 1257 report that we have recently submitted, or it's currently under agency review. So any thoughts, feedback, or any discussion on the literature review document?
I guess it's on the record. Just we had talked earlier before we started recording, and I'll provide a few upgrades, suggested upgrades, along with the references to address a couple of points.
Sure. Thank you. And that was Henry, right?
Yes, sir.
Awesome. So if our online members who are joining us via WebEx, if you can say your name first, that will be awesome for our note taking. And one of the questions before this meeting was how can workgroup members submit their feedback? We are open to various platforms. You can, if you have many changes in the document, you can use track change mode in the document that I have shared with you and return that to us. Or you could just simply email your comments or thought to anyone of us between Nelson, Bob Edelman, Dwight Flemia, or myself. So you have all our emails. And that needs to happen before September 17th. Any other questions on the literature review part before we get into the second part? Hearing none, so I apply that 7-second principle. I'm not sure if it's 7 seconds or 9 seconds, but I use 7-second principle. If I hear nothing, I take that as a yes. Thank you for that. And getting to our second agenda item for the day, Virginia PFAS Sampling Study Summary. As you can see a map on your screens, this was the map that we planned for our sampling event back in March 2021. We came up with a variety of systems for our sampling study, totaling 50. So essentially our plan was to collect 72 samples, 72 sampling locations from 50 waterworks. But after a lot of back and forth, we were able to do 45 waterworks to participate in this study. So we were able to take 63 sampling locations from these 45 waterworks. We conducted initial sampling. The results, they did go through extensive verification validation step, QA/QC at VDH. We found some data irregularities or things that we were not satisfied in that QA/QC procedures. We did resample at 4 locations, and now we have data from all 63 sampling locations from these 45 waterworks. On the record is the method that we used for this sampling event was EPA method 533, which is isotopic dilution method, which may be different from some of the other state sampling event where they may have used 537 or 37.1 if you see some analytes that are different in our investigation. We did take some source water samples, and EPA did not have any approved method for source water sampling analysis for these PFAS analytes. So we did use DOD method. It's presented in their quality service manual. If you want more information, we did share sampling study design with all the work group members in March, April. Please refer to that document. So essentially getting directly to the PFAS sampling results. I have just 3-4 slides on that, and it's a summary of the information. I have also shared the same information in a 9-page document with the workgroup members on September 7th. If you want to see some more details on how we selected those sites, what were those sites, what did we find, what method, and other QA/QC procedures. So the high-level summary is that we have observed at least one PFAS in quantities above practical quantitation level at 15 of the 63 sampling locations. And again, of these 15 detections, one or more samples from 5 waterworks, they had one or more types of PFAS detected at a concentration equal or to greater than 10 parts per trillion. In our sampling study, out of these 45 waterworks, 63 sampling locations, all other detections, they were below, or not, I shouldn't say other detection, all detections, they were, all individual PFAS detections, they were below 20 parts per trillion or less. Okay, the highest concentration of a particular compound that we detected was 51 parts per trillion of HPFO DA, which is also known as GenX, at one sampling location. Continuing with the results summary, PFAS sampling results summary, we had 6 PFAS analytes that were specified in House Bill 586, and House Bill 586 gives us the flexibility to analyze for more PFAS as we deem necessary. So here's to start with, here's some data on the 6 PFAS analytes that were mentioned in the bill. So PFOA was observed above this PQL of 3.5 parts per trillion at 4 sampling locations, and the measured concentrations, they varied between 4.2 to 5.5 parts per trillion. Similarly, PFAS was detected above PQL of 3.5 parts per trillion at 7 locations, and for PFAS, the measured concentration range was anywhere between 3.9 parts per trillion to 7.1 parts per trillion. We did detect perfluorobutyrate, PFBA, above the PQL of 3.5 parts per trillion at 10 sampling locations, and the measuring concentration, the measured concentration varied between 3.7 to 12 parts per trillion. Similarly, perfluoroheptanoic acid was detected above PQL of 3.5 parts per trillion at 3 sample locations, and the measured concentration for PFHPA was between 4.1 and 5.5 parts per trillion. You also have these sampling results in the 9-page document that I shared with you on September 7th. Continuing to these 6 analytes, we did detect perfluorohexanoic sulfonate, perfluorohexane sulfonate above PQL at 1 sample location, and the concentration was 4.9 parts per trillion. PFNA was one analyte out of the 6 that we did not detect at any of the 63 sampling location above PQL. And other than these 6, we did detect 4 additional PFAS chemicals that were not listed in 586, and those are GenX. They were found at 2 locations. The numbers were 4 and 51 parts per trillion. And perfluorohexanoic acid in the range of 6.8 to 12 parts per trillion. Then perfluoropentanoic acid in the range of 7.4 to 14 parts per trillion. And similarly, PFBS was detected in the range of 4.2 to 5.6 parts per trillion. So those were the detections that we measured, and we did, although this was a limited occurrence, PFAS occurrence study, so based on the sampling results or the occurrence, we came up with some of these findings, that all of the samples that had PFAS present above the PQL, they were taken from surface water sources. We did analyze some groundwater samples, so they were not in this category. And all but one, they were entry point samples. So that is also based on the findings from the result. ODW nor DEQ, we did not collect any additional samples to identify potential sources of PFAS contamination at these locations at this time. There may be some such sampling effort in future, but so far in this sampling study, we did not do any such exercise. The other major finding is that 10 samples out of these 15 locations, they were from waterworks in Northern Virginia region. They had at least one PFAS present in a quantity above the PQL, and none was above EPA's health advisory level of 70 parts per trillion, individual or combined. PFOA and PFAS. For the sum, we did not include sum of 6 or sum of 25 for comparing these numbers here. And the numbers that we have detected for PFOA and PFAS in the sampling investigations, they were below than any other state MCL standards. So here is the half of the table on the detections from this investigation. We did share this this table in the 9-page document. So if you want to, I mean, this is too small, at least for me. But please refer to that 9-page document. All this is telling the same concentrations that I just summarized in my previous slides. Here's the second part of the same table that was too big for one slide, so I just broke it into 2 parts. And as I said, we did use method 533 that can analyze 25 analytes, PFAS analytes, but these are the PFAS analytes that were detected.
Tony,
Yes,
so we've got one comment, and entry point means that this is the point at which water enters the distribution system. And so there was somebody wanted a clarification of that, and that's the only one.
Yes, entry point means the entry point to the distribution system. Bob, you want to add anything?
In some cases, the entry point is right as the treated water leaving the treatment plant. In some other cases, it's where water transfers from one water system to another and enters the distribution system of a consecutive water system.
Thank you. Any other questions in the chat, Nelson?
No.
Okay. Thank you.
So, just to make sure I was reading that right, so the one hit for Gen X of 51, they didn't find any other PFAS P4 compounds in any of their sampling of finished water. It was just the Gen X.
Yes, sir. In that sample, we did. Yeah.
Can you just, so somebody on the chat asks for the group members in the room to identify themselves.
Oh, this is Jeff Steers with DEQ. I was just confirming what I thought I was reading there, that there is no other, it just strikes me that they had a 51 part per trillion hit on Gen X and there were no other compounds found them.
Yes, Jeff, so I can add, and again, Bob, feel free to add if I miss anything here. So essentially, for this particular location, we also identified that thing, that there's nothing else. I would like to point out that we are reporting concentration above PQL here. If it is below PQL within an identifier, we are not reporting that. We did confirm this with the lab, whether it's a legitimate hit or do we need to resample if there are any QA/QC issues. And lab confirmed that there are no QA/QC issues. So yeah, and traditionally, I mean, with my understanding is that GenX was primarily used as a replacement for PFAS, that let's stop doing that and let's start using this. So that could be the reason, but again, we did not resample at that location.
Is that well water or
It's surface water.
surface water? But the source wasn't collected, or that was below the PQL?
For each water system, we sampled either the raw intake or the finished water, but not both.
But not both.
So yeah, so this is Nelson Daniel. That sample, I believe, came from Spring Hollow Reservoir, which is a storage facility off the Roanoke River. And that would have gone through treatment.
Yeah, that's after the treatment plant, yes. And to clarify, we did offer the opportunity for the water system to resample, and they did resample earlier this month, but we don't have the results just yet.
Okay. But from the first sample, lab was confident that there are no QA/QC issues.
Correct.
Okay. Thank you, Bob. Any other questions?
The DoD reported groundwater contamination in Newport News, Hampton, Virginia Beach, Yorktown, and I believe Chesapeake. Did any of the well samples we drew correspond to those geographic areas?
Do you want to take that?
No.
So I think that's Dr. Mann, right?
Yes.
So essentially, I think in our original plan, we did identify some groundwater sources, but then I think some of the DoD facilities did not participate in this sampling event. So in short, that we did not sample any of those groundwater areas.
Thank you.
Okay, so that was the summary that we shared with all of you. Bob Edelman has shared that with the subgroup, and then after subgroup's feedback, we shared it to the larger work group. If you have any thoughts or any concerns or any comments on the results summary.
I had a couple that I forwarded to Bob by email, but just at a high level, I think.
Jamie, can you identify yourself?
Oh, sorry, Jamie Hedges, Fairfax Water. I know we haven't gotten to the final report, how this is all going to get put together yet, but if somebody just flips to this sample study, and I actually didn't forward this comment to Bob, it might be nice to have a summary, kind of a 1 or 2 sentence summary at the top that is kind of parallels what you all have near the very end, where you're saying all of the samples are, below the 70 and below MCLs set in other states, just to kind of cut to the chase. I think it's important at the front end of this to note that this was a limited one-time sampling event, and that there were the limitations with the budget and the number of sites. It's in the footnote right now, but I think it's important to bring that up to the front of the report so people have some context that it's not a statewide, it's not a comprehensive, like we sample every water utility, or that we sample more than once. I'm not a lab person, so I'll fully admit that. When we talk about PQLs and stuff, I think it's helpful to say what that is for the general public, for people who are going to pick up this report and read it. And I think you all have done a good job of kind of talking about the ranges and the different types of hits there were. I'm a little confused why we're using we say this many samples were below 10 parts per trillion and this many samples were below 20. I think if I'm an uneducated reader, I read into that 10 and 20 mean something. And I don't think that's the intent. Maybe just stick with the bullets, the sub-bullets that are there where you've got the actual numbers.
Yeah.
And then I had one other comment about the, there's, I guess this third paragraph in the end where it says the results suggest PFAS are present in drinking water in Potomac and the Occoquan. I kind of feel like maybe that's trying to draw a conclusion with not a lot of data, so maybe just let the data stand on its own.
Yeah, I would agree. I had a comment on that too. Thought that sentence is out of place.
Any more comments, Jamie?
I think it might be helpful also in the beginning, I think, well, to kind of say what the objective was. You have this limited amount of money, so you kind of have this objective of let's cover as many people in the state as possible that are served by public drinking water. You kind of back into it with how the GIS layers and some of these other things, but you kind of started off with an objective, I think, of let's try to capture as much of the state population as possible and see how far that gets us. We all know that from the conversations, but somebody who's reading this the first time isn't going to necessarily read into that.
Sure.
That's all I had. Sorry.
Oh, thank you. Thank you so much, Jamie. I appreciate those comments. And again, here I think we are doing two things. One is PFAS sampling study results. We'd like to release this to the public at some point. And the summary that we have created, that 9-page document, is 9 pages because we wanted to add some context to it so that people can understand what we did, how we did, and what does it mean. So anything that helps in improving the understanding, we'd love to make those changes. And after that, our plan is that after we get the feedback from this work group on this summary, we make those changes, edits, and then share it with all the participating waterworks who are not member of this work group, and our local health districts and ODW field offices, so that they have a general awareness of what is happening and what we are going to release, and answer any of their questions or concerns. After that, we hope to have these published on ODW PFAS webpage. That is the release of this PFAS sampling results that we were envisioning. So any questions on the process or on the document?
Tony, this is Nelson.
Yes, sir.
There are a couple questions in the chat. One is, were any of the samples collected of finished water treated with GAC or other treatment activities that may have removed some of the PFAS from the raw water?
Yes, I think we did sample at finished water at 17 large waterworks in the Commonwealth, and I'm assuming
we didn't either ask the waterworks about their treatment processes, and we haven't noted any treatment processes in any of our data.
Yes, absolutely. But some of those may or may not have it, but we don't have that information.
Okay.
Yeah.
There's another question about learning more about the Spring Hollow Reservoir, and specifically what BIPTs permittees may have been in the area. So I guess that would be upriver on the, on the Roanoke River.
So as I mentioned earlier in one of the slides, Nelson, that neither ODW or DEQ at this point, we haven't investigated that, what could be the sources of that PFAS contamination. We may do some exercise in the future, but at this time, we haven't done any such investigation.
Okay, Jeff, you want to add something?
Yeah, I was just gonna say, I don't wanna jump ahead with what was on the slide here, but, that may be one that warrants further look at and maybe some sampling of source water in the future as we try to parallel that with what we know about upstream uses that we're about to go embark on our survey of all of our industrial users and 50's industrial permittees. So we may find that useful in the future.
So while we're on that, there's another comment that says HB 586 tasks the work group to identify possible sources of PFAS contamination found in the study. And then it asks, what will the report say, for example, of what the possible sources of the Gen X on the Roanoke River?
Yes, as I said, like we have completed this sampling study in August. We're still we have compiled these results in August. So we're still working on it. We did not finish the report, or we didn't finish this investigation. But whatever we are reporting is till September 9th or September 10th. So far, we haven't done it. As I said, like we may do some preliminary source identification for some of these sites, but as of now, we have no data on that.
Okay. So two more right now. There's another person suggested that we do, and this is something we've said before, that we do a better job of explaining what the PQL is and some of the terminology that we're using in the report, which that's in my notes, and that's something we need to do. And then there's a suggestion that, where we've talked about showing a version of the sample map that's limited to where the hits are found, or to show where we detected PFAS. And I think that's something else to consider, either in the summary report or certainly in the final report.
Absolutely. We have some plans to map all these locations where we conducted samplings, where we found some hits above PQL, but those maps are not ready at this time, so that's why we are not sharing it. And definitely, I think raising this question of PQL and some other technicalities, when we, I think, release these sampling results to the public, I think it will be wise for us to take those fact sheets that we developed in our communication toolkit and share it with with these results, so that people can see the health impacts. If they want some more information, where they can read it. So I think those 1 or 2 fact sheets, they provide good information to the general public. Okay. Any other questions from the work group or from the chat? Nelson?
Just real quick, you may have said it already. Do you have a time frame for when you're planning to publish this on the website?
Jamie, that is why we have a question mark.
Okay.
So what the process was that in today's meeting, we are seeking feedback from all of you and from the work group members that are joining us via WebEx. We'll compile all this information, make those edits, share it with all 45 waterworks that participated in this effort, share it with our local health districts and Office of Drinking Water field offices for their awareness, and then release it. And depending on the feedback that we receive today, we can formulate that date to release this. So that is why we haven't put any specific date on that yet. And any other comments, thoughts? Okay. So the next item, the last item, last line on this slide is phase 2 sampling event suggestions. So as you all are aware of, that Generous Assembly gave us $60,000 to carry forward this effort. So if you have any thoughts or suggestions for our phase 2 sampling, please do share with us via email what we should consider in our next sampling event. The first sampling event was a great learning lesson for us, all of us, I think. We learned a lot, but we need your feedback or things to consider before we design or come up with this phase 2.
So I guess as reference, what was the budget for the phase 1 or for the work we've done so far?
Sure. So essentially, in the first phase, our budget for analytical work was between $40,000 to $45,000, and we are not including any other costs or human resources. That was the analytical cost for analyzing those samples at a certified lab. Is that correct, Bob?
Yeah, we're right around $40,000 to $42,000. So when the dust settles, that's where we'll be.
Sure.
That was with sampling by the Waterworks personnel, not one or a group of people doing, just a small group of people doing the sampling, and that did include field blanks and analysis of the field blanks at all the sites. What we've seen in other studies is that they've had a small group of people collect all of the samples, and that cut down on the number of blanks they had to test.
Absolutely, and that's the kind of feedback that we need, and that's the kind of changes that you may see in our next round. That for this sampling event, we collected field reagent blank with every sample. In our next effort, as Nelson mentioned, there's not a requirement of analyzing FRB with every field sample. So we may skip FRB, or we may do a field reagent blank at certain frequency, 10 or 20%, if we can find a pool of people who can do this sampling event for us. So those, you may see some of those changes in our phase 2 sampling.
So Tony, there's a question, how many samples would 60K pay for, including staff, HR overhead?
I can tell you that the analytical cost varies for method 533. It varies from $300 to $350 per sample. So you can calculate the number of samples that we can do with $60,000.
I guess the HR and the overhead and things like that.
That is a question for our business unit, I guess. I'm still learning that myself. Right? Okay, so I think we're running a bit behind on our schedule. So getting to our subgroup updates, as I mentioned earlier, we have 5 minutes for each subgroup to present their findings or their learning lessons or concerns here. And after this subgroup updates, we have a quick break, and followed by that, we'll discuss House Bill 586 outline, recommendations, conclusions, limitations, concerns. What do we want to be part of that report or not, right? So going to our first subgroup, health and toxicology. Over to you, Dwight.
Let me know if you can't hear me. I'm trying to speak as loud as I can. So our group, what we decided last week, or the previous, not the meeting that happened earlier this week that got canceled, unfortunately, because of technical difficulties. We still don't know what happened to that one. But we postponed that to September the 13th, Monday, next week. But what we decided prior to that meeting in August, our August 25th meeting, was that probably the best approach would be to just say that we don't necessarily have the resources or the expertise to make any sort of offer up any MCL for PFOA or PFAS, and we should take into consideration that EPA is also in the rulemaking process. I don't know exactly what that means or what that means as far as a timeline. And then the other part of that was with the other 4 compounds that are part of the bill, there really isn't much data, scientific data, to do anything with those. And if you look at even what a few of the states did, they do what's called a read-across analogy, which you can do it in certain circumstances. You probably could do it with this, but you'd have to get a little bit, you'd have to have more data. But it's essentially, this looks like that, so they gotta be the same thing. Well, there's a couple of things that already point away that that can't necessarily be the case, because if you look at them, different states are looking at different endpoints for toxicity for compounds that pretty much look the same. So we don't feel there's really enough data to go on with that. One of the compounds, I forget which one, is the PFB. No one has an MCL for that compound. The other thing that our group is aware of is that based on the occurrence and monitoring, PFNA wasn't found in any of Virginia's water, so why would we even spend time on looking at that? So that's where we are as far as my group. Did you want me to discuss anything what we talked about on the phone Tuesday? You suggested what would our group do as far as an MCL? Because at this point, the last time I spoke with my group, we weren't necessarily putting up or proposing an MCL. Anybody out there, correct me if I'm wrong. However, you mentioned when we talked earlier this week that we probably should still come up with something to satisfy the bill.
Yes, that, I mean, we will be talking about those processes probably in the next part.
Okay, good. All right, so then that's the update for my group right now.
Any questions for Dwight? Thank you, Dwight. Moving to our PFAS occurrence and monitoring subgroup, Bob.
Well, so this is Bob Edelman. So Tony has presented much of what our subgroup talked about, I guess a week ago, Thursday. So the one thing that that's probably useful for this group to hear is we did have a conversation and did some brainstorming on kind of the next steps and recommendations from this subgroup as far as what's next. And so we had a couple of questions that we worked through. The first question we answered was, do we have enough occurrence data? And the group had a resounding no. We need more data because there's 2,800 water systems and we sampled 45. And then we asked, well, where should we do additional sampling? And so one member expressed a need for a temporal data set, in other words, time, not just one sample per water system, but perhaps multiple additional samples from places that we've already monitored, plus as many water systems as we can to fill in the gaps in the picture. One of the big gaps is groundwater systems, or well systems that use wells. We only monitored a handful of systems, 5 systems if I'm not mistaken. There are also some suggestions to look at the Environmental Working Group sample results and Department of Defense sample results to help make decisions about where to do some monitoring. We asked about community versus non-community water systems, and the consensus seems to be that to focus on community water systems or community plus non-transient, non-community water systems. We talked about finished water versus raw water intakes, and so we had some input not to write off raw water intake sampling, and I pointed out to the work group that the raw water samples tend to have more frequent elevated dilution factors, which means the PQL is higher, and so the result is you can't see as low as you're used to looking. There was a suggestion that perhaps ODW could sample the finished water with the water system collecting the raw water sample, so that we can have the before and after treatment. There were some questions about what DEQ is doing, and we talked about that. And we talked about different analytical methods Should we continue with the methods we're using now or consider something else? Didn't seem to be a groundswell to change direction there. We talked about the detection limits, and again, it didn't seem to be a need to change what we were doing. What we're doing seemed to be fine. And we talked about sampling by the water system staff versus having a dedicated sampler who went around to different places to collect the samples. And so one thought was that we or ODW would get more for the money by having the water system collect the samples. But on the other hand, the USGS, who's doing the study in West Virginia, had used dedicated samplers, and so there's some pluses for that as well. That gives some more consistency to the sampling. And so there's definitely pros and cons, and I pointed out that some of the data irregularities might have been due to some sampling error, and so that is part of the cost to delegating the sampling to the water systems. But on the other hand, a dedicated sampler can make mistakes too. So it's hard to say. So those are some of the things that we talked about looking forward to the next phase. Any questions?
Thank you, Bob. I can start because I think all the things that your subgroup discussed, they're really important and key items. And I wanted to share that when these bills they were in the process, we came up with this approach where we propose that we can do a comprehensive study. But of course, in that comprehensive study, it would require resources and time and money. And that would be very expensive study. So I think what your subgroup is mentioning that look at before and after at various times, dedicated people, that all requires some good funding. So in future, if we get some such funding, we'd love to do that. And that was one of the reasons why I invited USGS folks to our work group meeting, so that we can see what they have done in West Virginia, if it was successful or not. And our partner DEQ, they already have an established relationship with USGS on some of the aspects. So I think like it boils down to the funding. So if we find some good funding, dedicated funding, we can achieve most of the things that you mentioned. So thank you so much. Any other comments for Bob Edelman? Okay, thank you, Bob. Hearing none, we can move to Dan Horn, our Treatment Technologies Subgroup Lead. Dan?
Well, good afternoon. We have assigned writing of our technology summaries. Those are being worked on. It has been suggested by the people who are working on those summaries that we need some guidance on what potential MCLs to look at, because it makes a difference on cost estimates, whether you're trying to get down to 70 parts per trillion, 20 parts per trillion, 10 parts per trillion, 3 parts per trillion. That really affects the cost of the treatment technology. So, we need a little bit of guidance on that coming from somewhere. And other than that, we're moving forward.
Thank you, Dan. Any questions for the treatment technologies? Dan Horn?
Hey, can I have a comment?
Sure, sir.
Dan, this is Dwight. That's a good comment that you made. One of the things that I saw one of the states do, I don't know which one it was, but what they did is they actually provided the treatment technology cost, even without knowing what the MCL is based on a tier approach. So I mean, I think it would be appropriate so that everyone knows if we adopt 3, if we adopt 10, which I think all the numbers you called out were perfect, 3, 10, and 20, what the cost would be. I don't think you really need to go higher than that because I don't think we're going to find anything above 10 in Virginia.
So when you say 3 and 10 and 20, you mean bringing the PFAS level down to 10, right?
Well, in other words, if we said the PFAS level should be 20, we would want to know what it is to bring it down to 20. What's the cost if we had to bring, maybe 13 down to 10 or 20 down to 10, that kind of. That's just what I've seen other states do, and I would think that the board may want to know the cost anyway. I mean, because that I think factors into the final what's adopted anyway, isn't it?
And one of the things, Dan, if that makes your life a little easy, is that we'll have to come up with some fictitious numbers here. I mean, and again, those numbers may not be accurate, and again, our waterworks, I'm sure they will do their due diligence and their investigations before they use those numbers too. But I like Dwight's approach that we can pick some numbers, bringing down from 30 to 10, bringing down from 30 to 20, what it'll cost. So I think this will provide some guidance on the cost. That will not be an exact number, and I think for this subgroup that will be a good productive document, I would say.
Tony, this is Nelson. There have been a few comments in the chat to that effect, looking at tiers or including something in the report that says in order to achieve a proposed MCL for a specific compound or group of compounds, this technology can get it to this level at a certain cost, and if you go to a lower level, this is what it does to the cost, so that as you look at greater levels of treatment and which compounds can be treated, how that affects the cost.
Absolutely, that's a great comment. Thank you for that. And in fact, on the same lines, I attended the EPA conference last week where I think some person from Calgon presented at the conference, and he made some similar comments, and he mentioned that the cost to get the number from 30 to 20 may not be similar from 20 to 10, because as we go down, it's more difficult. And also, it depends whether the water system has longer chains or shorter chains. It varies a lot. So that is why I'm saying the document that subgroup or the work group will produce, it will not be it'll not be something that Waterworks can blindly follow, and they'll pick this number and they'll install it. So it'll be a guidance, I would say. It'll give an estimate of the cost or things that would be required. And as I mentioned earlier, our Waterworks, they would do their due diligence, they'll do their investigation too before installing any such treatment. Awesome, thank you. Moving to our, yes, sir.
Yeah, Mike Hotelling, Newport News Waterworks. I guess the only one, those numbers that Dan threw out, I might question 3. 3 is below the PQL for PFO and PFAS, so you wouldn't even be able to measure an MCL of 3, at least with current technology. So I'm not sure 3 is really the best number.
Yeah, this is Dwight. I concur. Maybe the number should be 5. If you want to have a number less than 10, just not knowing where we would ever go with it, offering up an MCL or an MCLG.
Absolutely. And again, Dan, we would leave that to you and your group to pick that number below, I would say 10. I mean, it could be 5, it could be 4, or that works for you.
Okay, that gives us some things to think about, and it'll be a range of estimates, as was noted. It depends on what you're dealing with. Is it sulfonic? Is it acid? Long chain, short chain, esters, ethers, whatever. They all act differently and get removed differently.
Yes, absolutely. Any more questions, comments for treatment technologies?
Tony, so there's one in the chat that said, in its budget funding request to the governor, has VDH included a request specific to further PFAS testing? If so, how much has been requested? And VDH's budget proposals are being considered by the governor's office and the secretary's office right now. So those aren't, they're just under consideration. I think that's where we have to stay with that.
Sure. Thank you, Nelson. Moving to our policy and regulation, to you, Nelson.
Thank you. So the policy subgroup met after the last work group meeting, and we met again in mid-August. The work so far has focused on preparing summaries of laws and regulations in states that have established MCLs, and then the most recent meeting focused on drafting an outline for the report that the work group is working on, and kind of formed the basis for what you shared with the work group before today's meeting. Some of the main issues that came out of our work were, we felt that we should address whether the results suggest that the list of 6 compounds listed in the bill should be expanded, or if the bill addresses the appropriate compounds. There's a suggestion that states should be grouped or viewed in the context of, when we're looking at what other states do and the limits that they have set, or if they're not doing anything, but basically we should view this in the context of the extent or the type of restrictions that are in place, looking at established MCLs, advisory levels, reporting levels, or if there's proposed legislation. And kind of, there's a recognition that nationally regulation of PFAS is inconsistent. And for the states that have regulated PFAS compounds, look at what they did to support the waterworks achieving the MCLs. And also note that the majority of states have not taken action, and compare that with the number of states that are doing studies and not taking action. So states like West Virginia, where the USGS has been doing work, but there doesn't appear to be any effort in the state to set MCLs. There's a question about treatment technologies, which Dan and his group have just addressed. And then the final suggestion was to include information about what other states are doing with respect to funding. And they cited the example of Minnesota using part of an $850 million settlement with 3M to support its PFAS program and paying for research, testing, and treatment, particularly in the Minneapolis-St. Paul area. And next steps, because of time constraints, we're not certain about our next steps.
Sure. Thank you, Nelson. Any questions for Nelson, policy and regulation?
Hey, Nelson, this is Bob. What did you learn about the states that are not setting MCLs? Are there like lots of different reasons?
We haven't looked at that.
Oh,
We just know that they're not, we don't know.
okay.
And that's something that we may be able to, that research may be out there, either somebody doing it locally or somebody like ASDWA may have more about that. Good question.
And actually, Bob, I'm on that ASWA PFAS panel. They are coming up with a white paper for the states at this time. They may have some, not a whole lot, but some of their thoughts on why they're not doing that. Because in that work group or panel, there are multiple states that are still in thinking mode. So they're part of that, I guess. And to you, Nelson, you mentioned West Virginia. So West Virginia did that sampling. Was that because of a regulation that they had to do it, or because my understanding is that USGS approached them, they had some detections, they found some money, and that's why they did it, right?
If I recall from the presentation, yes, USGS had money, West Virginia contributed, but I don't think there was legislation that drove the sampling.
Absolutely, and I think Maryland is probably in the same boat that they're conducting this in a phased approach. But again, the driving force is not a legislation that drives that that effort. I guess that's the difference. Probably in Virginia here, it's driven by the legislative efforts. Okay. Any other questions for Nelson before we go on a quick break? Hearing none, so it's 2:17, and let's take a 5-minute break, and we will rejoin at 2:22. Thank you. And Nelson, you can stop the recording if you want.
Okay. We resumed recording. Dan Horn pointed out, and this is for the lawyers that are present, with the Minnesota settlement, lawyers' fees took up about $150 million, leaving $700 million.
Lawyers get there every time. 700 million, so a lot. Sorry.
And in favor of lawyers, they got that 700 million that state may not have otherwise got it, right? Okay, so getting to our next agenda item, House Bill 586 reports and recommendations. So maybe I can come back to this later. So Nelson did discuss this outline with his subgroup, got feedback, revised it, and what you see on the slide, it's a very, very, very abbreviated form of that outline. All I wanted to show here was that I have shared a different version of the outline with you on September 7th. And at this time, we are requesting your feedback on the major things that should be a part of this report, shouldn't be a part of this report, something that we emphasize on, something that we should put less emphasis on. As Jimmy, you mentioned that there could be some of the things that we can highlight at certain places to give some more clarity to our readers. So we are seeking suggestions and feedback here only on the contents. So I mean, I'm not sure like if all of you got a chance to go through that outline, but briefly it's some background information, and then history, development of PFAS, where it came from, and then presence of these contaminants in the environment, health effects, and then probably PFAS in Virginia. What's our experience so far? We have some detections in UCMR and then probably later on DoD sampling. So we'd like to add whatever we know about PFAS in Virginia. And then essentially the whole point is comparing what we know and what we should know, and then finding that information gap. Why are we doing, or what should we do moving forward? And then PFAS regulatory approaches in different states. They must have realized this information gap at some point, and that's why they drove to that regulating such chemicals in their drinking water. And then our House Bill 586 implementation, what the bill is all about, what did it ask us to do it, how did we implement it, starting with our work group and all the work group members, the expertise, the structure, logistics, things like that, and how we formed these 4 subgroups that have done an amazing job. I couldn't ask for more. In less than 10 months, they were able to achieve so much, and I really appreciate that. So giving a good overview of PFAS work group, how it is structured, how it is functioning, and then how we came up with some deliverables out of our work group. For example, communication toolkit, how we designed the sampling study, how we conducted that study, what did we find out in our sampling investigations, and followed by I have added that section on limitations that again we did our best with the given resources, with the given time, and our ability to do, but again, was this the best, or could we do it better? Were there any limitations? So I thought there should be a section where we can mention some of those things, and followed by conclusions and recommendations. So that's the story that we were envisioning for this report. So anything major that we have, or even minor, that we have missed in the outline of this whole story that anyone wants to point out? This is especially important given the deadline of December 1st. We have an internal deadline to submit it to VDH leadership by mid of October, 15th of October. So that gives us about a month and 5 days. So we are seeking feedback on the report contents and the recommendations and other things now, so that we can come up with a draft of this House Bill 586 report by the month end. And we plan to give our work group member an opportunity to review that draft in 5 days turnaround time, and after that we'll have about 7 working days to make those changes to meet that October 15th deadline. So that's the process or plan that we have in mind. But this outline was especially important because we didn't want to write this 200-page report thinking and later on realizing that, oh, we wasted these 40 pages and we shouldn't have done that. So that's why we're emphasizing the outline, and then we will start filling material in there. So any thoughts on the outline or structure of the report?
I have one.
Where does the lit review fit in to the final report?
I'm sorry?
The lit review?
Uh-huh.
Where does that, I didn't see it listed in the outline, but is it?
So essentially, literature review was one of the asks in the bill.
Okay.
Like the bill asked the state health commissioner to form the work group, look at what other states have done, that literature review, conduct a sampling study, make recommendation. So essentially, in the bill implementation, there will be a section that
It's not part of the report then?
the literature review will be a part of this report.
It will be a part of the report?
Yes.
So
It was a requirement in the bill.
So more of like an appendix, or
Yeah.
how's that gonna work?
So essentially, that's a great point. Again, we don't want to include a 140-page literature review in the body. So definitely, we will summarize. We will summarize the literature in a condensed form. I'm not sure, like.
Can you move the outline back to the outline slide? Thank you.
Oh, there it is.
Right.
Okay.
So it's in there.
Yeah. So essentially, I mean, all the deliverables that we have come up with will be part of this report. But again, the whole document may not be in the body of the report. It may be an appendices. So for example, this sampling study design, it may be or it will be a part of this report, but again, it will be in the appendices, not in the main body. In the main body, it will be a summary of what we designed, and for more information, it's presented in the appendices.
Thanks.
And Dwight, you had
Yeah,
some?
you can go back to the other slide. I don't know how important this is, but I mean, if you are talking about the outline, I think that it should be broken down until you have your introduction. Background information is, to me, is more or less facts that you already know that you're starting with. Then you should have maybe a results section. Sometimes the results can go in the background. It's all subjective, but anyway, intro. You should then have a discussion section where that's where you talk about some of the stuff where you actually what you've learned from that, and then also have your results section. I've lost my train of thought. Limitations, I think, is a great one, and the conclusion recommendation. And then, of course, you're going to have a reference section. I'm wondering if simple things such as where we talk about, I guess you're talking about you're going to list each person that's on a work group and say what their background is. Of course, I think that kind of stuff goes into an appendix. I think if you make this the shorter, it'll be the better. I'm also wondering if I haven't seen other states do this, but I haven't looked at which other states have submitted to their regulating bodies. But would it be better or beneficial if, such as the tox group, we wrote our own document and then you kind of had that more or less as an appendix versus trying to have what we want to say meshed in with what 4 other subgroups are trying to say? It seemed, in other words, have separate reports from each group, maybe even add that as an appendix or something, or supplemental documents.
I think, like, that's my opinion. Again, when we'll submit this report to these legislative committees, I mean, of course, we formed these subgroups to make our things more transparent and more accessible, to have more discussion, smaller groups, they can meet more frequently. For this report, I was thinking that this report will be, from VDH in conjunction with PFAS work group. Within that work group, how we structured is can be a good point on the structure side. But again, I think, like, eventually we all know that, occurrence and monitoring did this and toxicology did this. But in this group, in this report, I was thinking that it will be a story that how we implemented it, how work group formed, and how work group functioned, what did they do, and what did they find. Okay. But in special cases, for example, I'm just picking up one, this sampling study design, we definitely want to add that as an appendix because we cannot insert the whole thing in the main body. So if you have any specialized material, which I'm sure Tox Group has, all these studies, their values, their numbers, their things, if you want to have a separate appendix that deals with the health and toxicology, we can certainly explore that option as well. But eventually, I didn't want, or maybe, that's my personal thing, that we didn't want to say that, oh, there's 4 individual summaries from 4 individual subgroups, and there's sort of no connection in between, if I say, for lack of that. But again, that's my opinion. Any thoughts, Nelson or Bob or anyone else?
We've got a couple of comments. One regarding the report contents, and I guess this is one of the observations or conclusions or or just statements of fact that will come out of this is that you're conveying the idea that we need to make clear, and the suggestion is we make clear at the beginning of the report that the study had a limited size and a limited number of samples relative to the total number of public waterworks in the state. And also note that the study did not look at private and small groundwater well systems. And the second comment is that it would be helpful to include plans or details on the phase 2 sampling if we as a work group can agree on those by the due date. And whether we do that as recommendations or we actually come up with a plan, that may be dictated by the time limitations. And then there's another comment that they would prefer one report from the work group as opposed to having parts for the subgroup to kind of mesh in what the findings are from the work group in the larger or overall context of the report, rather than having individual subgroup reports.
So I would like to mention on the first two things. The third one we already discussed, and we can discuss more maybe after the meeting, White. Scope of this study. I think I agree with that comment that we should have some section in this report where we mention the scope of our sampling study, what were our boundaries, what were we trying to do. So I agree with that. Phase 2, including in this report, to me, they are two individual efforts. They're not tied together, although phase 2 will be in continuation to this first one. And again, if time would have allowed us, we would have loved to do that. But again, we have 1 month to complete and finish this report. And writing that report, getting feedback, and combining all these things, and then designing a phase 2 in such a hurry, I fear that we may miss some of the information there. So,
but I think we could the work group could certainly make recommendations.
Oh yes, absolutely, and that is what I mentioned in my previous slide, where I'm seeking feedback from our work group. The last line. If you have any thoughts or any ideas, any suggestions, comments on phase 2, yes, we would love to entertain that. But again, completing that and including that as a part of the report, I think within this given timeline may not happen. That's what I'm saying. Yes, sir.
So refresh my memory. The report's actually going back to the GA. Is the Board of Health getting it? Is the Health Board getting it too, or how's
so essentially
being disseminated?
Sure. So essentially, we will submit it internally on October 15th. Then it goes through internal VDX processes, through Office of Commissioner. It goes to the Secretary's office, and then to the Governor's office, to these committees.
Okay.
So that's the path.
I guess just looking, because like your agency, we do a lot of reports to the General Assembly, probably more than many agencies. I think there's a good blend I think we could do where there's sections in the report that are, brevity is good for something like this, at least, to get that first weed of, here's the introduction, and a short, here's our conclusion recommendations. But in between there, I think it would be great to have each of the subcommittees have a couple paragraphs that just hit the high points of what it is they did or found and any recommendations. But keep, if they've got a full report, have that as an appendix, and anybody that wants to do a deep dive can do that and get more background that they need. But it would be good to summarize the findings of each of the subcommittees in not too much detail, at least, but enough to get the message across about what they worked on. And
sure.
And the easier to read, the better you're going to have, at least the people reading it.
Mm-hmm. And the way I'm thinking is that once we have this content outline and fill this material, the content ready, and I think there could be some visual aspects of the report that we can work on. We can have some small text boxes to highlight the points that Jeff, you're mentioning. So we can certainly do that, and I'm sure that those features will definitely enhance the readability of this report. And I'm sure, like, if we write a 300, 400 page report, no one will have the time to read that. So I think 80% of the folks, they would just go through the executive summary here to get more information. So definitely.
Dr. Mann agrees with the idea of a tight executive summary.
Yep. We will have for sure. And again, the outline that you see on the screen, it's a very, very abbreviated form. I mean, there will be many other things. I didn't mention acknowledgements. I mean, that's a huge part of this effort. I mean, this wouldn't be possible without all of you. So there will be a lot of extra material that will be in this report that I didn't highlight here. So all I wanted to show was that we have a story here, and for some more information, we have shared the more detailed outline with you through our subgroup, Nelson, or through my email. And then if you have thoughts, so that we can start filling this this outline to get the draft ready by end of September.
Can I just throw out two more thoughts?
Yes,
Go
sir.
back to that other screen. And it's probably because I haven't seen the document yet, so I apologize for that. But anyway, I think the military facilities in Nassau, we know they're a big source of contaminants in the environment, so they should be up there. Seems kind of odd to have their own special place. I think it should, maybe you should have, instead of presence in the environment, I don't know if you're just talking about just in general how it gets in the environment, or maybe it should be more tailored to Virginia or something like that. Maybe move the military facilities up there. I think one of the other things, and then I'm not sure what prior to legislation means, but you don't need to elaborate because I know we're short on time. But I think another thing, unless it's going to be elaborated in there somewhere else, because if it's getting sent to the General Assembly, I think based on just where we are here, they not necessarily know exactly what the whole process is for developing an MCL. And I think there needs to be somewhere in the introduction where you talk about the MCL process. And what, I mean, I think that's a big point to help the rest of us when we write, you know, where we are or what our role was and what we did.
Great point.
And just for everybody, when I say MCL, MCL and MCLG are the same thing to me. So I know there technically is a difference, but just when it comes out of the tox group, unless it's specifically said, MCL and MCLG to me means the same thing.
Sure, thank you. That's a good point. So we should definitely add some of such verbiage in the introduction.
So,
And just off that point about the MCL process, it's probably good to mention too, again, you know, the fact that EPA is working on something that usually we like to rely on national standards, but they haven't been able to do that yet, and somehow kind of where we are nationally when we look at it.
Yeah, and I think like I probably need to apologize for that, because I have I couldn't capture everything that Nelson and the subgroup captured. So in that outline, that information is there, state and federal scenario, where things are, and then move forward from there. So essentially, I think, yeah, I mean, if you haven't seen that document, I would highly recommend doing so, and then give us your feedback, right? Yes, Nelson, you were saying something?
Just in response to what, Dwight, your comments, as Tony said, that he's just created a snapshot of what the outline looks like, and although half of the slide is introduction, the actual text to cover that will be a few pages, not.
Yes.
That's a small part of the report, and I think when the House Bill 1257 report gets published, it's supposed to be published on October 1st, you may see how some of these ideas are already taking shape. And so that report's going to be published before the draft of this this report is due. So that may be a preview of what we're looking at.
Absolutely.
There's another comment about mentioning that PFAS are present in rainwater in low levels, which could accumulate in surface waters. And if we want to address that, and I think if we talk about PFAS in the environment, that can be considered, but the flip side of that is that we didn't do any research to look at that issue.
Sure, and the way I was envisioning, and thanks for clarifying that, Nelson, that I have this half-page introduction, but in actual it will not be that long. All I wanted was that the reader should definitely understand what is PFAS, full form, where they came from, some story, and then definitely probably in first page itself, we'll narrow down to that our scope for this report is just drinking water, because there will be a whole lot to this PFAS thing. And I'm sure we may see some of that in other DEQ things, because they have a broader area that may contain some sort of such things, right? Okay, and then I wanted to spend most of our time on this slide, because after that I don't have much, except I definitely wanted to give credit to Amanda for this map. But this is the only slide that I wanted for our today's discussion, that we know what was this PFAS domain, how it entered, what other states are doing, what EPA is doing, what did we do, how did we design study, conducted study, summarized it. From this work group, what I wanted was, what do you think? What recommendations or what conclusions shall we add to this report? Because that will be the heart of this report, and I wanted all of us to have ample opportunity to contribute your thoughts in this whole process. Because we don't want to, I mean, of course, we will, as a VDH-ODW, we will have our comments or recommendations in there, but we wanted this to be an inclusive report or inclusive recommendations where we get good feedback from our work group, and without those recommendations we cannot get that draft ready anyway, right? So I mean, these are some of the questions, not a whole lot, just to stir up that discussion. What do we think? Are we satisfied? I mean, that's a very broad thing. I should have worded it differently, because again, with the given resources, with the given time, I think we did good, but again, was that enough? Probably a discussion question. Do we have any recommendation for future occurrence study? The question has been up in this discussion already 3-4 times. We have, and I'm sure most of you can share or will share that feedback with us. Do we agree if one or more of these chemicals in drinking water, they have known health effects and can pose or may pose danger to public health or concern to public health? Do we have enough information to proceed on one or more or 2 or 3 or 5 of these compounds? If yes, then that's fine. If no, that's fine. But again, I wanted to throw in these questions just for the discussion and open up this discussion starting from the room if anyone has any thoughts. So all essentially we are trying to do here is to get your thoughts on recommendations and conclusion so that we can add that to our report. Nelson, do you want to add something?
So I'll start. Jamie Hedges, for those of you who aren't in the room and can't see me. So I know we went around and we got reports from all the different subgroups, and like in Bob's case, it's kind of like, we got the study done, here's the results. I think there are probably some recommendations from the group, but then maybe not necessarily summarized on the report. heard Dwight talk about with the talks group is, I guess I was kind of expecting once we got to this point that we would have the work kind of written conclusions or recommendations from the different subgroups that the work group as a whole would be discussing, and I think kind of discussed where everybody is, but I'm not, I think trying to, seems pretty ad hoc to just be talking about recommendations and conclusions without having necessarily those group reports. I mean, I think the treatment technology to me is kind of sort of like Bob's. It's kind of like data, kind of an overview of what's available and what's achievable and how much it costs. I think the talks group. I think those findings are really important to this discussion. So that's just me.
Sure.
From a process standpoint, I think that's kind of what I thought we would be heading.
Sure, absolutely, and I can say, Jamie, that a lot of this information or the conclusion or the findings, we have these scattered in various documents. For example, the talks studies. I mean, I think a lot of those studies they are summarized in that literature review part. But again, if you are referring to a, let's say, 2 or 3 page document from each subgroup on recommendations, I think we can certainly come up with some such document if that helps the work group. But so far, I think we have rolled those in to our other documents that we have created so far. Any thoughts on Jamie's comment or any new thoughts, questions, comments?
Hi, Tony. It's Philip. I'm on the phone from Potomac Riverkeeper. I don't know if you want to go to the phone yet, but I guess a quick comment. I generally agree with Jamie. I mean, I think it would help, especially I think it would help to get that kind of cost comparison on the different treatment, on DAC and the other treatments, what it would cost between getting the numbers down to 30 versus getting them down to 5 or whatever we decide those other tiers are. That certainly might help inform some of the recommendations. I guess my only, I'll stick my neck out a little bit. I think in terms of initial recommendation thoughts, just brainstorming, it seems like it would make sense for us to recommend that additional sampling be done and that additional resources come from the legislature to do more sampling. I'm of course interested to hear if other folks think we don't need that, but it seems like, we did find various levels of PFAS, thankfully fairly low levels at a number of facilities. What we've done so far is really just in terms of statistically, it's just a snapshot, right? I think we all agree on that. It's a very small number sample size compared to all the waterworks in the state. So I think if in addition to whatever else we recommend, I think it would make sense to recommend more resources from the GA to study, and then we'd have to decide whether we want to recommend how those resources are used. There's a lot of different options, right, in the phase 2 sampling and beyond about you go and resample the same facilities. Do you expand to sample raw water and finished water at the same facilities? Do we sample new facilities? Do we do a combination? There's obviously lots of discussion there, but I guess I would leave it there. I think I agree. It would help to have a little more detail on the cost and treatment. It would also help to review the literature review, the draft literature review, since we just, we're under tight time frame. So, we just got it a couple days ago, but I think at least to skim through that and see if there's anything new in there that might help our discussion. So I'll stop there. Thanks.
Thank you, Phil. That is helpful. And definitely, I think I agree with your assessment that it doesn't matter which direction we go, we definitely need additional resources if we want to do anything comprehensive here. So I appreciate that. Any other thoughts, comments?
Hey, this is Dwight. I have a comment just for lack of knowledge, because I don't have any experience working in a waterwork. But it seems like the group is still concerned about collecting more samples and testing the water. And my question is it, one could just be related to because we don't know, but is it because you feel that the sampling that was already done wasn't complete enough, the data wasn't any good, or that you were hoping that your waterworks came back with a 0 reading? So I guess I'm wondering with the, and then if somebody could put that into perspective with, what other states do the other, maybe 30 or 40 states, what they did across their states is similar to what we have, or is it that I'm missing something and what we found in Virginia is really high? So I guess I'm just wondering why we keep talking about why we need the new sampling.
So this is Bob. So part of the problem is to start with the scope of the sampling was really limited.
Okay.
We only sampled at 45 water systems, and so part of that is it was actually focused for the most part on surface water systems too, for that matter, which means there's a large part, actually the vast majority of water systems in terms of numbers, not numbers of persons served, but in terms of numbers, are actually served by groundwater sources, in other words, wells. So we haven't done justice to groundwater sources, and we're nowhere. I mean, this wasn't even a representative sample. This was meant, I think, to sample in places where we thought we might have problems. I mean, either prior problems or a large population served. Quite frankly.
No, that's like I said. I wasn't sure. I mean, I know that everything all the other groups are doing is, y'all are the knowledgeable ones. It's just I just keep hearing we need more sampling. I thought that that would be what we had was good.
To follow up on Dwight's point, so the sampling has shown that there is PFAS in the Virginia water supply. So now further sampling is just going to define the extent. I mean, it's a given that it's in the water supply now, correct?
Yeah, it's been detected. I guess that's probably a fair statement in certain places.
Yeah, as we reported in this sampling event, at least one PFAS was detected above PQL at 15 out of 63 sampling locations. So based on that, we can say that, yeah, it is there. And I can tell you that PFAS, it's everywhere because we use it so much in our daily lives. So that was expected as well, that it will be detected. We often say that, a limited study, small study, to put that into perspective, for example, Pennsylvania, they analyzed, I think, 400 or 450 water systems. And they have a total number of systems as 8,400. So if you do the math, they also sampled probably close to 5% of their systems. And they have a proposed regulation for some of the PFAS. I think for P4 and PFOS, at least I know for sure, 14 and 18 parts per trillion. Not that we should follow that, but I'm saying that in Virginia, we say 45 out of 2,800. And in most of the states, again, Bob, correct me if I'm wrong, the majority of the focus is on community and non-transient, non-community systems. TNCs, they're not included in most of these MCLs in many of the states. If there are one-off exception, I'm not aware of that. So if we do the math based on that, 45 out of probably what, 1,500 systems, right?
Something like that.
Yeah, I mean, don't quote me on that, but that would be probably 3% of our systems. The type of study, as Dwight mentioned, like New York, they did a sampling study, and they want this study to be completely unbiased. And in Virginia, we have a completely biased study because we identified those systems based on something, right? That's why, I mean, I take this as a bias. Their approach was like a lottery system. Just put everything in a bowl and pick up and randomly and select it. That was their way of doing a random check on their system. So, I mean, there are different designs that can be done. Of course, I mean, I personally would have loved to do a more comprehensive, detailed $1 million study. But comparing this study with some of other states, I mean, they have done 5%, we have done 3% in our phase 1. The big thing that Bob mentioned is that probably one thing that was sort of we weren't able to do was a representative sample from different type of water. Surface water, yeah, we did a good proportion of that, but groundwater samples we didn't capture that much. All right, source waters, yeah, I mean we were expecting that if there are some WIPPs discharges, there may be some hits, and I think like we saw, at least to my understanding, lesser hits than what we were expecting based on those WIPPs discharges for whatever reason. So that's the summary. On size of the study, yes, we always can get better data with more information. And in fact, the original design that we put together for a comprehensive study was that pick a representative number of groundwater systems, surface water, source waters, then do a seasonal variation, what happens in the monsoon, what happens in winter, snow, and so that we get a good spatial temporal variation in the PFAS thing. But again, I think most of or many other states, they are doing the same. They are taking one system, like in Pennsylvania, they took one sample, they analyzed, I mean, they did it for 450 waterworks, and they came up with that regulation. And there are some states probably that may not have gotten that sort of opportunity too. I mean, recently, I think Delaware, there was a legislation in Delaware, and again, don't quote me on that, on regulating these PFAS chemicals probably pretty fast, within 1 month, 1 year or so. They may not have even an opportunity to sample. So just to put things in perspective here for our discussion. I hope I didn't say too much. Yeah.
So and one more comment. At least, well, with the source water or the sampling that we've done hasn't uncovered anything that's really worrisome. Okay, so just because it's detected doesn't mean it's a problem, but the levels are low, and so that's not inspiring us right away that we must proceed with the MCL. Isn't that right?
I would disagree, and say that.
Is that Anna?
Yeah, this is Anna. I would say that. I mean, we're just as thankful that what we did find didn't prompt any immediate actions based on the health of consumers at this time. But I would say that based on the work we've done, we have found the presence of PFAS in Virginia. We have many more questions about where it may be, what levels it may be at different times of the year, or in different types of water sources. We've done a lot of work in this work group to gather a lot of information in a short amount of time, and I think that information and the presence of PFAS pushes us forward in continuing to both look for more, doing more testing, but also pursuing the remainder of the regulatory process. I don't think it means that we stop here.
Thank you, Anna. Thank you for your comments. And sure.
I'll just add that, it's with these emerging contaminants and what we're talking about with PFAS, we're learning more about the sources. We've been notified of a couple of more DOD facilities in the Commonwealth that have some releases, some of them somewhat significant. They haven't gotten off their installation, they haven't left the site that we know of, but it just shows that as you study and keep looking for it, you're going to keep finding it in different levels. So it's, you know, it's kind of that measured approach that we're trying to take a DEQ of peeling back the onion. And I'm hopeful that when we get, by the end of the year, we get results back from our survey, we'll be able to identify potentially where we want to go out and require self-monitoring and DIPD's permits or industrial user permits. So I don't think it'll ever be the end of the story. It's just, you know, we're telling a story at a certain point in time when a limited amount of sampling was done. And clearly, if we can get more funding, I think more sampling is appropriate just to try to better get that data set. You know, I guess all the scientists and engineers saying, you know, more data is always better, but that's got to be balanced, obviously. And so, you know, if we can, you know, at least in the report, come to a conclusion that, yeah, we think there is more effort that's going to be needed, and, you know, the funding is an important mechanism of doing that. That's all.
Oh, thank you, Jeff. And to your comment, Anna, we are not stopping here. It's just that we're trying to summarize, or we're trying to see what can we conclude, or what can we recommend, and how can we move forward. We will still be doing what is required under the bill and under the requirement under the bill implementation. So it's not that we're stopping here. It's just that we are getting feedback on what work group feels should be the next steps. For example, Phil mentioned that we definitely need additional resources to do more on this. There was a different comment on the extensive study, right? So switching gear here, it's 3:10 and we have 20 more minutes. I came up with this table, right, where first column contain PFAS analytes. The 6 are what is mentioned in the House Bill 586. Then there are 4 additional ones that were not in the bill, but we detected even at 1 or 2 locations. And then I try to use that the SIDWA, Safe Drinking Water Act methodology, whether there are health effects, whether occurrence is there, best available treatment technology is available. I'm just trying to see if there is a meaningful opportunity to look at regulating these chemicals. And then what other state MCLs have done, I mean, just trying to summarize here, and what's EPA's take on these PFAS chemical at this time. I can share with you that EPA will be coming up with the proposed rule on PFOA and PFAS by April of 2022, at least that's what information I got from my sources. So, I mean, for this work group to discuss, you know, for these 6 PFAS chemicals, there are 5 that have been regulated by other states. PFBA, there is guidance in some of the states, but I didn't find any MCL for PFBA. Recently, EPA came up with a toxicological profile for PFBA, so it's still developing. So if we feel that you know, we know that from EPA's determination or EPA's intention to move forward with these 2 chemicals, EPA wouldn't move forward if they don't know health effects. They wouldn't move forward if they don't see a good occurrence. Usually they consider, or not usually, most of the time they consider the treatment technology data. So EPA moving forward with PFAS tells me that we have some information, or at least enough information, at least on these 2 PFAS chemicals at a national level. We may not have that information here in this work group, but it is there. Otherwise, EPA wouldn't come up with some such proposed rule, right? I would like to hear thoughts and comments from this work group on these 2 chemicals. What?
Tony, Mike Hotel, Newport News Waterworks. I guess
Yes,
that
Mike.
column about EPA moving forward, I think EPA would probably challenge what's shown there. I mean, they're doing a lot of toxicological research on those compounds, and then UCMR 5 is also doing occurrence testing for those compounds. So I would think they would say we are moving forward. We're just not moving forward as quickly as PFOA and PFAS.
Mm-hmm.
So if you would change EPA moving forward to EPA rulemaking,
Yeah,
that
I
might
guess
be
it's a little more nuanced than just yes or no. It's each of these compounds are at different stages of analysis.
Mm-hmm. Thank you, Mike.
This is David Jurgensen, Chesapeake, kind of on the same thought. Will one of this group's recommendations be, or I think one of this group's recommendations is going to be, what is the appropriate action moving forward? And just spinning off of that, if EPA is doing rulemaking, then what, if we're going to recommend rulemaking, then we would be recommending that the state spend its funds on doing something that would actually, in fact, be a redundant effort to what EPA is going to be doing simultaneously. And so I think that weighs into the considerations. Is it worth the state's money to do the same thing that EPA is doing and then come out with potentially or very likely different results, which then can create that inconsistency and that conundrum that you have when the state rules and the federal rules are different? So maybe we, so we just, I guess we just need to consider that as we move forward with our recommendations, so we don't spend money on something that another agency that is actually very adept at doing that rulemaking and can take all of our information in the process. Just throw that out for thought.
Sure. Thank you, David.
This is Anna. I wouldn't agree that this would be redundant. I mean, Virginia may find that a lower level is more appropriate for protecting Virginians' drinking water in the Commonwealth, as opposed to what EPA may determine, and that sort of difference, it happens. It may well happen in these other states that have MCLs. I also, we could be optimistic about whether EPA finishes this in a timely manner and it doesn't go through challenges moving forward, either politically or in the judicial process. But I think that's a big question. So I would still think it's in Virginia's interest and the public's interest to move forward with state regulation to protect the public.
Thank you, Anna.
This is Jamie. I would disagree. We don't know what's going to happen with EPA. EPA could very well come back with a lower MCL than the state would issue, and then we've got water systems that have already committed capital to trying to deliver a level of treatment that then's gone to waste, and they have to regroup and start over again. And I don't think that's in Virginians' best interest.
So, Jamie, your concern is that if EPA comes up lower than our number.
Right, because you've got to live with their number.
Sure.
If it's lower.
How long does the process in Virginia take?
There's never been one.
Yes.
So nobody knows.
But in other words, if we propose an MCL or MCLG or whatever, does it have to? Is the process going to take a whole year where EPA would already come out with a number, and then we would just go for a hand and say, hey, let's take EPA's number?
So Nelson, could you elaborate on the process from NOIRA onwards?
As the law stands now, we are obliged to follow the standard rulemaking process in the Administrative Process Act, which involves providing the public notice of intended rulemaking, proposal of or introduction of proposed regulations, and allowing the public to comment on those, introduction of final regulations, allowing the public to comment on those. What we can't control is how long it takes to do executive branch review of each of the 3 stages. And really the only thing we can control how quickly we go from, once we complete the public comment period, we can control how quickly we go to the next stage.
Right, so the period's 90 days, or some of them 30 days?
So there's a 30-day public comment period for the NORA, a 60-day public comment period for the proposed stage, and a 30-day public notice or notice of a notice that the regulations are going to be final. So there's 120 days of public comment period. There's also to go from proposed to final, you have to have it's 30 or 60, or there's some time period before you can introduce final regulations after you've come out with proposed.
So
now,
that puts you into April anyway. But once you start the process, well, you wouldn't necessarily want to retract it.
At any time you can step off the.
Okay.
You can step out of the regulatory process. You can also, there's a fast track process that assumes that there's no public, effectively that the public supports the action. And if we get a lot of public comments, we have an obligation to respond to those comments, and that can be very time consuming and very resource intensive to try and address public concerns. And DEQ, we had some hurdles with the waterworks regulations, and I can't imagine what DEQ has had to go through with some of their regulatory actions.
It's a couple of years at least.
It can be a very lengthy process when you get thousands of comments from the public, and you have to, and we're, as an agency, are obliged to respond to those comments.
And we would have, and I'm assuming maybe a portion of this group or something, because usually you form a regulatory advisory panel to help you craft the regulation. So it's a process.
Yeah, so essentially, Nelson, one of the comment that Jamie mentioned was that what if EPA comes, I'm just taking some fictitious situation here. What if we come up with a number, then EPA comes up lower than that during the process?
Depends on where we are in the process. If we have proposed a number and EPA, and it depends. Does EPA come out with a draft, or EPA goes to the same, not exactly the same, but essentially the same process that we do, and EPA puts out a proposed rule, accepts public comment for 60 or 30 or some time period. Then EPA has to address the comments and come out with a final rule, and if they can get over the legislation or litigation or whatever opposes that, then it becomes effective. So if we proposed one number and EPA came out with something lower, and say we've gone to the proposed stage, then we could make a change between proposed and final to come into alignment with EPA, and that would be something that we would note in that process, and the public would have an opportunity to comment on that, and we could make that change. If we are final and EPA established an MCL, then we have to conform our regulations to EPA's, and there's an exempt process for that for us as a primacy state, where if we accept the same MCL as EPA.
Because we cannot be any less stringent than EPA.
No, you can be less, less is correct.
Yes,
less meaning above.
Yeah.
Yes, our limits have to be no less stringent than the National Primary Drinking Water Regulations.
Okay. Awesome. Any other comments?
Tony,
the
this
report is due before.
I'm sorry.
I was going to say, the report is due before the General Assembly session. And so the General Assembly in 2022 could, who knows what they could do.
Sure. Someone from the WebEx?
Yes,
Philip.
hi Tony, it's Philip from Potomac Riverkeeper. Just a brief comment. I think I would agree with Anna. I think it makes sense, and some of the other commenters. The difference between the state's process here in Virginia and what EPA may or may not do is that we have a choice with the state process, right? We can decide to move forward, we collectively in the state, ultimately, to develop standards. It's hard to know what EPA will do and how long that will take. I've been doing this kind of work for a long time on various regulations, and it can take an extremely long time. It could take 5 years for them to finalize a regulation like this. So I think, I do understand Jamie's, I completely understand your perspective as the regulated entity that, you don't want to have to switch gears again. On the other hand, technology changes, treatment technology can change. I don't know, again, not suggesting there's going to be new technology out there in three years that's going to make this all simpler, but I think it behooves us to move forward in some fashion, and whether that's keep collecting data, develop a process to figure out what range of MCLs is appropriate. Whatever the process is, I think it makes sense for Virginia to keep moving forward. And if EPA moves forward at the same time or on a parallel track, I don't think we're losing anything. We have Virginia-specific data. That's the best way to inform a regulation for Virginia. So, just my 2 cents. Thank you.
Thank you, Philip. Any other thoughts?
For some of this is Jessica with Groundwater. So most of the states that have the MCL, did they have gross contamination where their levels were much higher than sort of what we've been? What am I looking at here? So these are.
So the slide shows states that have MCLs, and they're in red is the heading. States that have non-regulatory or non-enforceable levels, the heading is in black for the state.
But a lot of those states in red had pretty egregious contamination events, right?
Michigan did for sure.
Minnesota
Minnesota,
did. Yeah.
New Hampshire.
North Carolina.
North Carolina. I just don't see us falling into that category.
The DOD suggests we have egregious contamination. The DOD data suggests contamination in Langley, I believe it is.
I was just comparing the two, us compared to some of the other states that have issued low MCLs.
Yeah, our sample study is tiny right now. And we didn't look at, I think one person is commenting, we didn't look at military facilities, and that there is significant contamination in some military facilities in the Tidewater area.
Yeah.
And
but those aren't impacting waterworks.
Right.
Well, the waterworks that they're impacting have been separated from, they're not providing drinking water right now to those persons.
I don't know that I heard everything, but I think you were asking, and maybe it was answered, I apologize for my hearing, which states, because it's true, states get motivated by having gross contamination. That's kind of what you were hitting at, right? Just more or less. So Minnesota has the 3M Cottage Grove, I believe. I don't know the exact name, but Minnesota has, that's the one that had the recent lawsuit, I believe. North Carolina has Gen X or something down there. Georgia or Alabama, I think it's Georgia, has a chemical plant down there. I forget the name of that one. And then there's the Ohio Valley one, which was the DuPont one. It's right on the, I think it's in West Virginia, but it's the Ohio River, something like that. So if that's kind of what you were asking for.
Yeah, I was just curious, are the states that are regulating right now, have they had,
And some of them have gotten a lot of money, like Michigan has done all
Yes,
kinds of
and so-
sampling with wildlife and ag and biosolids. So they're looking for it more, and they're finding it. And I know Wolverine Manufacturing was a facility in Michigan that was a party to a lot of this.
And I think Pennsylvania is not in this, right? Yeah, and they have recently come up with the proposed reg as well, so I think it's pretty fresh. And again, thanks to Amanda Waters for sharing this map with us. Thank you, Amanda. This is very helpful. For our previous presentations, we were showing older maps with some crisscross, so this is good. So, any
Tony, this
last
is
minute
Dan.
thoughts?
And I'd like
Yes,
to
Dan?
specifically address some of the concern about what's been found on the military bases or at NASA over on Eastern Shore. Yes, there have been findings of PFAS at places like Langley or NAS Oceana or even Naval Air Base Fentress in Chesapeake and the Naval Annex in Chesapeake. Langley, yes, it's there in the groundwater, but it does not affect any drinking water sources because everybody over there is supplied by Newport News water, and that's nowhere near Langley Air Force Base. If you look at NAS Oceana, again, that contamination is on base at Oceana, and for the most part, that area is served by Norfolk water wheeled through Virginia Beach. There are some few private waterworks, one strip bar, for example, that is a regulated water system, not transient non-community, but those wells that have been tested have not shown PFAS. The contamination seems to be only on base at Oceana. At NASA over in Eastern Shore, there is a lot of PFAS in the groundwater. NASA has installed a treatment facility which is now in operation to remove PFAS from the water which goes to the town of Chincoteague. And the last one is Fentress Field, again, and Naval Air Base, a lot of PFAS contamination, and the Navy installed treatment facility to provide the water, safe water or PFAS-free water at Fentress. They are providing bottled water to the people who live in single-family homes around that area. So, you know, that's what's going on with the military facilities there, with the exception of Northwest, also in Chesapeake. They have found PFAS in the water along with MTBE and some other petrochemicals, and that is being investigated. But at this point, it does not affect the drinking water system. They are looking to install treatment so that they can use a different set of wells that would be affected by the PFAS.
This is David Jurgens. This is David Jurgens
Yes, David.
Chesapeake. Yeah, I can add just a tiny bit to what Dan just said. The Navy is also, for NALF Fentress, they are paying for city water lines to be extended to that area so that we will be providing city water to all of the impacted customers around NALF Fentress, and we're nearing the final design of that project. And that's going to run in the neighborhood of $10 million for that water main extension. And then down at Northwest Annex, I don't remember the numbers, if there are any detects or not off base, but they had 2 well fields that they used for their on-base water system, one of which did not have detects, and the other one was the one where they detected it. So yes, there have been detects in Chesapeake. They are pretty narrowly confined, I guess, or narrowly located, and they're with Sentinel wells and the actual potable wells that they've done the sampling on, fairly well defined. That's all.
Thank you, David. And first of all, I would like to apologize. We are running after 3:30, but it's really interesting and very important topic. So I would say if you can stay with us for another 20 minutes, we'll wrap it up. For the records, I would like to mention that I've received 3 emails from people who couldn't join or who may have joined late. I'm not sure about that. They mentioned their feedback for the work group, so I wanted to share with them. So they had common feedback that probably Virginia is doing great and Virginia should do more for sure. We need more resources, but this time because EPA is already doing their work, so we should wait for EPA. And the later part of at least 2 of those 3 emails says that if we want to go the regulation route, then their recommendation or their thought is to just go for PFOA and PFAS, considering that EPA is moving forward only on those 2. And if we go a step further, one email says that we can probably, if we want to discuss some numbers, there could be an interim MCL of 70 parts per trillion, that is EPA's health advisory. And the second one didn't use the word interim. It says that probably we could do we would look into regulating these 2 chemicals at EPA's health advisory level as our MCL. So I wanted to put that on record as well for this work group. Okay, and so here are the next steps. Again, this process doesn't end here. I would highly recommend that if you could share your feedbacks or your concerns or what your thoughts are on recommendations with us till September 17. That way we'll have some time to incorporate those comments into our report and get back to you in the first draft that we plan on circulating by the month end. And as I mentioned, we plan on giving 5 days as turnaround time for our work group members to comment on the draft, followed by at least 7 days for us to make those changes so that we can submit this report on time. I do have other topics, and one was obviously I mean, we usually meet on a quarterly basis in this work group, but considering that we have a report due next month, do we want to meet in October or early October to discuss this one final time before we submit this report? And again, if you want to share any of your thoughts, that's great. The next item, as you see, is future of this work group. This has been very, very, very beneficial to us working with all of you. Again, we did meet virtually for most of the time, but for last 2 meetings, we get an opportunity to work with many of you in person. So what do work group members feel about the future of this work group? And eventually we can relay those suggestions, feedback to the state health commissioner, and then we can go forward on the future of this work group. PFAS regulatory process to implement these House Bill 586, 1257. We will have to go through a NOIRA process beginning in January. We would love to work with our stakeholders on this regulatory advisory panel. So if you are interested in serving on the RAP, please let us know. we'd love to have you on that panel so that you are part of this process or important process in Virginia.
Tony,
Yes, sir.
and I apologize for not coming on this sooner. We would have a regulatory advisory panel to develop the proposed regulations. We don't need, all the NORA does is says we intend to undertake a rulemaking. And the RAP would be more appropriate and much more beneficial to develop the proposed regulations. The NORA is almost a paperwork exercise. So as an agency, we can do the NORA, and we would call together the RAP once the NORA is out there.
Oh, thank you. And again, we are requesting feedback for our phase 2 sampling study. So I think like Nora Nelson explained, feedback on the sampling study, you can share that with us. And October meeting, what do we all feel?
We have 2 comments in the chat that are in support of that.
I would agree, Jamie.
Sure. Other thoughts?
Hi, it's Wendy. I would agree with that also. I think there's a lot more to discuss here.
I'm sorry, who was that?
Wendy.
Wendy.
Oh, Wendy.
This is Bob. This is kind of a stupid question. So at the end of the year, does this group go away because we've completed 586?
So that is the second item here, future of PFAS work group. I mean, I think for regulatory purposes, for House Bill 586 implementation, we will submit this report, and then probably that was one of the requirement of this work group. Essentially, I mean, in reality, I would love to have this work group, but again, it will not be in the same capacity that we are doing now. Right now, we are fulfilling the bill requirements, but once that bill is submitted or report is submitted, we will move to the next stage of that thing. So, but the final decision would lie with the work group members or the State Health Commissioner, because he formed this work group.
So next meeting would probably be October 7th or 8th. It's a Thursday or Friday before the report, the draft is due.
Probably 8th, 7th is my wife's birthday. I need to go home, right? Okay. So October 8th, please mark your calendars. We will send you the invite, and during this time, we would highly appreciate if you please share your feedback on any or all aspects that we discussed today. And with that, any members of the public for the public comments?
Tony, this is Paul Niffler. One question I had is whether there has been any discussion about including a section in this report about environmental justice, which I know is a complicated topic. But you know, the question of whether the cost of regulating and treating PFAS by drinking water utilities and their constituents, when those constituents didn't contribute to the PFAS problem in the first place. I know also there are other issues about potential disparate impacts in different areas. I'm just saying, like, is that something that has been considered? And is that something we should put in this, or you guys should put in the work group should put in the report?
I think, Paul, that's a great suggestion. Again, I can certainly look at the outline, but I think environmental justice equity should be a part of all the work that we do. And clearly, one of the other comment that I've heard from multiple members, work group member, is that unproportionate burden of the cost on our smaller systems who may not have resources. So I think we should definitely have one paragraph or one section on that EJ section. That's my thought.
I think this is Anna. I think that's an important topic to include. I think it should also include the predominance of facilities that may be contributing to this problem near communities of color and low-income communities, such that they do feel the brunt of the impact of toxic contamination generally.
Thank you, Anna. Any other member of the public?
Yes, hi, this is Carol Courtney from the Southern Environmental Law Center. I just wanted to chime in to say that I certainly hope that Virginia is proactive about this issue, uses this as an opportunity to kind of get ahead from what we've seen. I know we all know that this is an extremely limited study that certainly doesn't definitively nail down how much or what PFAS is in Virginia drinking water, but I think it's a real opportunity for us to be proactive about this, and given the uncertainty of the EPA time frame and timeline and how limited it looks like their action is going to be just on 2 PFAS, I think this is a big opportunity for Virginia to be proactive on this issue. Thank you.
Thank you, Carol.
Bill Mann from the public. If you have a chance to look at that United States House of Representatives HR 2467, that has a lot of discussion about who's responsible for cleaning up PFAS contamination, and it's extremely controversial. It might be worth looking at if you're thinking along those lines.
Thank you, Dr. Mann. Any other comment? Hearing none, I'd like to thank all of you for participation and all your feedback in today's meeting. And please look for an invite for October 8th for our October meeting. And before that, we will share some other documents with you. So please revert back to us within the given timeline. Thank you, everyone. And I apologize for this 15-minute delay. And have a wonderful evening. Thank you.
That's not the recording.
Thank you. Jamie, I like your idea of having some write-up, a couple of pages write-up from each subgroup. Probably, I think that'll be helpful to us as well, right, White?
Well, and I think certainly before we meet again on the 8th.
Yeah. No, I was thinking in next, probably, in next 10 days, because that'll help us in this report as well. So, okay. So we'll definitely look into that and do that.
The other thing for the 8th that you talked about continuing the work group beyond the completion of this report. I think it's a good idea, but kind of understanding what you were envisioning that we're doing would be helpful. Like, we had a pretty structured set of tasks for this, but
I think we may have to look into the needs or what it to do rather than, it's, I don't want, or we don't